How do you fix a leaky gut? Very interesting question. And there are many different ways to approaching this problem. In this video, I'm going to sort of go a little bit deeper into what we understand is happening in leaky gut right now and why it's so crucial for trying to address this issue as part of your overall chronic pain management. As we mentioned before, conditions like fibromyalgia are associated with almost a 60 to 70% instance of irritable bowel syndrome. And in conditions where there is irritable bowel syndrome, one of the features that has been noted is this phenomenon of a leaky gut. Now, it's not something that every researcher is going to be happy to use the word, but in common parlance, effectively, leaky gut refers to this ability of the tight junctions in the gut lining to become loose and leaky. What do I mean by tight junctions? Effectively, what we know is that the normal healthy gut lining, your intestine lining, is just one cell thick. That's all it is. And these cells are very, very tightly connected and coupled with each other, with then a mucin layer, a mucus layer on top of these cells that is on the inner side looking into the gut itself. They have this mucus layer, and in a healthy intestinal lining, you have your immune system and your bloodstream on one side. You've got the single cell thick intestinal wall with the tight junctions, and then you've got the mucus layer on top of the cell, and then you've got the inner lumen of the intestine, the tube of the intestine through which your food passes and all the other microorganisms reside. Now, many of the microorganisms are also residing within the mucus layer. What actually happens in the concept of leaky gut is when you take in ultra-processed foods, when you take in food that's high in inflammatory chemicals or sugars or energy-dense foods, or you have low-fiber foods, over time, what you're doing is you are thinning the mucus layer more and more. And that means that sometimes the lining of the intestinal wall, the thin single cell lining with the tight junctions, get exposed to more harmful bacterial chemicals, toxins, lipopolysaccharide, or even the fragments. And at that time, the junctions start to get looser and looser. What this means is that the gaps start to appear, and the harmful toxins or the LPS chemicals start to go through the light junctions and enter into the bloodstream. This state where the mucus lining is gone, the gap junctions are not that tight, everything gets a little bit more permeable, and we have biomarkers now called zonulin, which is a level of how much has transferred across this leaky gut, can all give us an idea of how the intestinal wall contents are starting to impact and activate the nervous system, the immune system in and around the intestine, and that then becomes the state of a leaky gut, which results in an activation of the immune and nervous system in the local area. So clearly, what we need to therefore do if we want to treat the leaky gut is to address all of these bits. How do you make the gap junctions tight again? How do you rebuild these gap junctions? How do you rebuild the mucus layer? How do you change the diversity of the microbiome in the gut so that it starts to become more healthier so that all of this can be achieved? You're almost reverse engineering what you've lost there. Ultimately, repairing the leaky gut is as much a case of paying attention to the lifestyle element of nutrition rather than me suggesting that there's a drug out there that does it. So what are the elements of rebuilding and repairing the leaky gut? First thing, of course, is to adopt this overall whole food, predominantly plant-based, possibly more right now, if you look at the evidence, more towards a Mediterranean style, high polyphenol rich diet is going to be the critical, important, overarching piece that you have to do. Within the element there, high polyphenol rich fruits. So berries, fruits that are rich in berries and polyphenols are going to be the first suggestion. At a practical level, these are going to be achieved by having 2 to 3 cups of fruits or vegetables in your daily occurrence of multiple colors. That's where the polyphenol comes along, and this is critical because they help in actually improving the junctional tightness, and they are the first piece that bring together and reduce the risk of leaky gut. The second is the use of prebiotics, so fermented foods like sauerkraut, kimchi, because these actually provide the food for the various other healthier microorganisms in your intestine, and that means that they can start to repopulate and improve the diversity of the microbiome. Thus the mucus lining starts to come through. This can be achieved by looking at maybe various forms of inulin, or the contents of inulin can be added to your diet, and that is a usually good way of adding both prebiotics, but more importantly the fiber as well that you need to feed these microorganisms. The third can be the use of omega-rich foods, which can be seen sometimes in fish and sometimes seeds like flax and chia seeds. That could be another important way there. Another important piece is going to be collagen-like substitutes, which can be through broth and bone broth-like elements. If that is something that you can have, that can be another way to build the biotin and certain other junctional elements back, thus bringing the health of the mucus lining and reducing the leaky gut. Lastly, there's been certainly suggestion that looking at other fibers, which can be in the form of onions or garlic or leeks, can also be useful as a form of fiber to improve your ability to rebuild and reduce the leaky gut. All of this can be considered in different ways, and there may be various food portion sizes that you'd have to change. Now, I'm not a nutritionist by background, so in this situation, to specifically look and see which combination of fermented foods or prebiotics or combination of omega-3 rich diets, or the matter of any kind of fiber foods or polyphenols, it's probably best that you get an opinion from a dietitian or nutrition to know the exact quantities, content that you need, and what kind of culturally appropriate diet that you could get these 5 elements from in order to repair your leaky gut and reduce it. Various supplements can also be considered. Zinc carnosine is a supplement there, L-glutamine could be considered, curcumin could be considered. These all could be again added in addition to all the other lifestyle elements that I talk about, which is sleep optimization, stress management techniques, movement-based strategies, stretches, mind-body techniques. When you can combine that along with some nutritionally appropriate and required amounts, then I think that would all help towards reducing the incidence of leaky gut and repairing any leaky gut that you may have. Hopefully that will all help in addressing your overall chronic pain. I hope you found this video useful. I look forward to seeing you in the next one. Thank you for watching this video. I hope you found it of value. So don't forget to like this video and subscribe to this channel and click on the bell button to be notified when the next video comes along.